Ace Medicine have analysed hundreds of medical school interview transcripts and have grouped the questions you are likely to be asked and qualities you will be assessed on into 8 core sections. These are first impressions, communication skills, questions on the UCAS, medical ethics, the NHS, common medical conditions, current issues, and personality match questions. We've constructed a mock interview for you based on these 8 sections, along with post-interview analysis, teaching, and tips. The aim is to teach you some vital information about common questions they can ask you.
Thank you for coming today.
Thank you.
Can I ask you how you found it getting here today?
Oh, it was fine. There was no traffic. I got here early, so
That's good. Why do you want to study medicine and not nursing?
studying medicine, you have a lot more control over somebody's well-being and their life. I think with nursing, you rely a lot more on doctors' instructions, and that's not really a role that I want to play. I'd rather make a big difference to someone's life purely by my own knowledge and understanding of the subject.
Do you not think nurses make a big difference to people's lives?
I think nurses make an incredibly big difference. Without them, hospitals wouldn't function, doctors wouldn't function. But I just feel that I think doctors play the role of, telling the nurses really what to do, because doctors don't necessarily always have the time. I understand that nurses always strapped for time as well, but I think that the doctor's role should be in, deciding how patients should be treated.
This candidate has made a good first impression, as she makes good eye contact and leads towards the interviewer. She gives an air of quiet confidence. She could, however, use hand gestures more to communicate her message, as well as smile more to display enthusiasm for the subject. Your interview may start with an icebreaker question such as, "Was it easy getting here for you?" Or, "What's the weather like outside?" This candidate seemed to have a good grasp of the doctor's and nurse's role. It is important not to belittle the role of the nurse when answering this question. To improve the answer, this candidate should have structured her response more clearly, stating firstly the role of the doctor and the tasks she has seen the doctor undertaking, then the role of the nurse and their daily tasks. This would show that the candidate had paid attention on their work experience, so had a realistic view of medicine. The doctor has more of a decision-making role. They examine patients, manage their treatment, perform surgery, and take more of an overall responsibility for the patient. A nurse has more continuity of care with the patient, so they administer medication, educate the patient and family about the disease, and perform minor procedures. They are an integral part of the team. You want to study medicine as you want to have more of a decision-making role and take on more clinical responsibility for patients. At this point, you should talk a little bit about your work experience, what you saw doctors doing, and why this is a profession you want to enter into.
What would you do if you had a patient who was in constant pain asking you how they could end their life?
I think being a doctor, you're not in a position to be able to help someone decide how to end their life, because your job is to help prolong life. So I think it wouldn't be in my position to help them fulfill that at all. So I wouldn't play a part in that.
The candidate jumped to her opinion without following the logical argument and structuring her answer. She should first state the question is about euthanasia. She should give the pros and cons of euthanasia, followed by her conclusion. She could also have shown more compassion towards the patient. This is a question about voluntary euthanasia or physician-assisted suicide. If you are asked your thoughts on euthanasia, it's important to know some background information. Euthanasia is defined as ending life in order to relieve pain and suffering. This is divided into 4 categories: voluntary, involuntary, active, and passive. Voluntary euthanasia is conducted with the consent of the patient. Involuntary euthanasia is conducted against the will of the patient. Passive euthanasia entails withholding common treatments necessary for the continuance of life. Active euthanasia entails the use of legal substances or forces to kill and is the most controversial means. The arguments for euthanasia are: it is legal to commit suicide. The Suicide Act was passed in 1961, so if someone wants to commit suicide but is unable to, surely they should be allowed help. The second argument is: it is more humane to allow someone who is terminally ill and who wants to die with dignity and end their suffering quickly than to force them to live with the pain till they die naturally. The arguments against euthanasia is: it is a slippery slope and it is difficult to enforce the law and prevent involuntary euthanasia. Follow with your conclusion. It is illegal in this country, so all you can do is to be there to talk to the patient, minimize pain, and improve their quality of life. You should give information on local counsellors they can talk to.
What would you do if you just told a patient they had HIV and they refused to tell their wife and they will continue to have unprotected sex?
I mean, obviously there's doctor-patient confidentiality, so I'm not sure that there is anything that I could do in this circumstance. I'm not really sure what the laws are or anything, but from what I know, I don't think that I can say anything.
So you know that he's going to go home and he may infect his wife and you will not say a word. You let it happen.
I know it sounds wrong and it's not something I would think is the correct thing to do, but from what I know, I have to keep the patient's confidentiality, so I don't think I could do anything in that circumstance.
Okay.
This candidate knows about patient-doctor confidentiality, which is a good term to use in the interview. She could also have mentioned talking to a senior member of the team to ask advice about such a controversial issue. How would you proceed? Confidentiality should be maintained unless the doctor suspects a third party is in danger or risk of serious harm. The doctors should first try and persuade the patient to tell their wife about the illness, but if they refuse to, then the doctor has a duty to tell the wife. Ideally, the doctor should first get consent from the HIV patient, but if it is not possible, they have a duty to prevent harm to the wife.
How would you break it to a patient they had breast cancer?
Well, I would explain to them in gentle terms, the condition that they have. I'd explain to them all the treatment options, what the prognosis is. I try and explain it to them clearly, and hopefully it would, and just not in a harsh way, just so that they completely understand and they do have some hope at the end of it as well.
What does the word prognosis mean?
The treatment outcome.
The candidate discusses the logical steps she would take and demonstrates empathy in her answer. She also mentions she would leave the patient with treatment options and hope, which every doctor tries to do at the end of such a consultation. You should be careful what words you use in the interview, as you can be pulled up on their meaning. For example, prognosis. Prognosis actually describes the likely outcome of a disease. First of all, you should prepare yourself to deliver the news and familiarize yourself with the patient's notes and possible treatment options. You should prepare your surroundings to ensure comfort and privacy. Prepare your patient by asking what they understand about their condition, or do they know what the tests were done for. Inform the patient of the test results honestly, in small chunks, so they can digest the information. Encourage questions and give them time. Most importantly, provide a plan for the future treatment options so they feel more secure.
How would you save money on the NHS?
From my past work experience when I was working in a pharmacy, I found that they regularly carried out medication use reviews, and that was just to ensure that patients were complying with the medication that was prescribed to them. So we did find that a lot of patients didn't know either how to take their medication, therefore weren't taking it at all, or patients found that they weren't getting immediate, obvious effect from the medication, such as patients that are on statins. Obviously, they won't be able to feel any difference, so they weren't complying with their medication. So I find that medication reviews are really important to ensure that money is not wasted on drugs for patients that aren't actually using it. And I think that could be quite a big money saver in the NHS.
Okay.
This candidate brings in her work experience and shows an excellent grasp of this particular initiative. She structured the answer well by first describing the initiative and what it was for, followed by an example of a particular drug patients did not comply with. There are many options in the news at the moment. One good answer is that prevention is better than cure. So public awareness campaigns, for example, the advert about passive smoking for children and emphysema in the next generation was quite shocking and thought-provoking. It could help change behaviour and prevent long-term costs of treating these conditions in the future, which will in turn save the NHS a lot of money.
Tell me about a patient you remember the most from your work experience and what they were suffering from.
I had one diabetic lady that she used to come in very regularly for her insulin. Whenever she came in, she was really tired, very irritable. She'd lost a lot of weight. She was having a lot of problems managing her glucose levels because they were always, through the roof. Because we would take it in the pharmacy. It was usually between 20 to 30. So her doctor was always very busy and found it difficult to see her. So we spoke to the doctors privately, gave them a summary of her condition and what they could potentially do to help. And within the month, she had her insulin regimen increased, her oral anti-diabetic drugs were also increased, and we found that her blood sugar levels were a lot better controlled. So that was quite a good outcome for that patient.
What's the normal levels, glucose levels?
It's between 4 and 7, which is fasting, and below 9 for non-fasting.
What does insulin do?
Insulin converts glucose to glycogen in the cells. So basically lowers blood, after you eat, for instance, your blood sugar levels spike. You release insulin to convert glucose into glycogen. That's basically what it does.
This candidate has excellent knowledge of diabetes and has structured her answer logically, which is very impressive. It's important to know the medical conditions you have seen on your work experience, as you are expected to come across as a future doctor, interested in the cases you have seen. This will impress the panel, as your competitors will not have done this additional research. To find out all the questions they are likely to ask you, analyse model answers, and run through interview role plays, you should attend ACE the Medical School interview course. This course has a 95% year-on-year medical school admission success rate, and you receive a money-back guarantee you get into medical school. You can book on acemedicine.com. If you want to book with your friends, you get a group discount. Just download the group booking form from acemedicine.com or call us on 0207 221 8097. For lots more hints, tips and advice from last year's applicants, visit acemedicine.com. Click on Free Insider Guides and download lots of useful medical school application information. Thank you for listening and good luck.